people, when they drink alcohol, they become extremely aggressive. And typically, if they were not drinking, they're not necessarily aggressive. Some people, on the other hand, with alcohol will fall asleep or get extremely sedated. But many people can become extremely irritable, extremely aggressive. And at that point, there is an increase in the risk of at least the possibility of becoming violent, either towards children, towards a partner, spouse, family member, or outside in the community. You'll notice here that substance abuse and disability clearly have economic impacts on households and on families, which then, of course, can increase the stress levels of couples. And then if you add other issues and problems and stressors into the mix, then it's even more, there's a greater chance of having more risk to becoming very impulsive and possibly violent and aggressive. The good part of all of this tonight that I'll eventually leave you with is that treatment of anxiety disorders are, in actual fact, treatable. That's the good part of this. Anxiety disorders, as you see here, occurs first in 68% of patients who have depression and anxiety. When we see children who have marked anxiety disorders, a lot of those children will have anxiety disorders going on into adolescence and into adulthood. But there is a large proportion of those children and adolescents who, at some point in their life, will go on to develop a depression. So, for example, when I see 6 and 7 and 8-year-olds who can't get to school, they're extremely what we'll call school phobic, because the anxiety comes on in the morning with the anticipation of going to school. If you can get these kids to school, usually the anxiety settles down and they can manage their day. In a lot of cases, of course, it's not even that easy. However, getting some of these kids to school is another topic of discussion. But these still are significant problems, even when the anxiety is controlled, because they run the risk that as they get older, they may in fact develop a depressive disorder. Not everybody does, but a lot do. Now, in terms of depression, the symptoms of a depressive disorder, which is different than just being depressed or sad or upset in relation to some situation that would make any of us upset or sad or if we're stressed, could cause it. An actual depressive disorder, usually what has to occur is that people will have a depressed mood completely out of keeping with how they typically function. This is a change. We're always looking for the change from normal functioning. And their mood will be depressed most every day for at least a 2-week period and most of the day. As well, typically they will lose an interest that they have in the type of things that typically cause them to have a lot of pleasure. So they're not interested in the type of things that they would typically have. As well, from a biological standpoint, what also occurs and must be present before the diagnosis is made is that their sleep is affected. Typically, they could have initial insomnia, they have difficulties initiating sleep, or they could have difficulties staying asleep because they've got frequent awakenings, or they're awake at 3, 4 in the morning and they cannot get back to sleep. And typically, if that is occurring, that they have terminal insomnia at the end of the sleep, usually that is when their depression may in fact be worse. And typically, that's when the suicide risk becomes worse and highest in patients with very serious depressions. And certainly on inpatient units, this is watched and monitored extremely carefully because this is the highest risk time for a suicide to occur. As well, appetite, there could be appetite changes, because we're all thinking something's going on in the hypothalamus and in the pituitary gland in the brain. So appetite is affected, as well as sleep. The energy level is down. Concentration is off. And sometimes people will present that with simply being, they can't make decisions. They're completely indecisive. Now, we're all indecisive at times, but this is very prominent. This are high-functioning people, or people who have not had any problem with making decisions of any significance. All of a sudden, they are just panicked and anxious because they just can't make the decision. Because it's, what if this goes wrong? Well, what if that goes wrong? And they cannot make it. That may be a way that they present. Also, they can have feelings of guilt and worthlessness. Again, out of keeping. They may be talking about something that happened when they were younger, and they're obsessed with it. Feeling this tremendous guilt of this one thing they had done in their life, completely oblivious to all the successes that they've had in their life, and all their strengths, and all the resilience and resources, and positive resources that they may have. But they will dwell on it. And then, as well, they may have obsessive suicide thoughts. Suicide thoughts just keep coming and coming, which typically they would not have, but it comes involuntarily. So you can have these symptoms, and as well as that, then there are physical symptoms that can occur as well. But remember, it's happening in the brain. So the hypothalamus is affected, the amygdala is affected. These are parts of the brain, and down in the brainstem. Before I talk about this, I just want briefly just to go through some of those anxiety disorders, just to describe them a little bit more. Generalized anxiety disorder. To have a generalized anxiety disorder, a person has to have irrational, unwanted over-worry. They worry about everything on a day-to-day basis. They may worry about ISIS coming to Canada. They may worry excessively about hurricanes, although we may get a little bit of hurricane soon. But they're worried, and they can't stop it. They can't prevent it from happening. And they obsess and worry and worry. And along with that worry, which interferes with their functioning, there's also physical symptoms of restlessness and being keyed up and muscle tension. Right? Their heart may race a little quicker. Stomach is in knots and they're sweating. In a panic disorder is this sudden surge, and this is very common and extremely demoralizing to anybody that's ever had a panic attack, and certainly have gone on to have a panic disorder. Because out of the blue, with no obvious trigger or stressor, all of a sudden, there is this overwhelming sense of panic, like anxiety, but now your heart is racing, your chest is tight, you can't get air in. Typically, when anyone's having an anxiety or a panic attack, one of the things that they will consistently say is, I can't catch my breath. I can't get enough air in. It feels like I'm choking. And sometimes they have difficulty swallowing, or they're lightheaded, they're dizzy, they're going to lose control. Their stomach's in knots, they're sweating. It feels as if they're not really in the room where they are. They're outside their body. And they may have pins and needles, or hot and cold sensations in their arms and legs. It typically does settle down. However, in a large number of people, what will happen is once they have the first panic attack, what will happen is now because it is so overwhelming, they will then worry about, is it going to happen again? Because sometimes it will happen. A very common situation that I've seen from time to time is somebody's just driving down the highway, and all of a sudden, never have had an anxiety disorder, never have had a panic attack, and all of a sudden it hits them. Nothing's going on, they're just driving down the highway somewhere, and they have to pull over the side of the road, and typically what do they think? They're having a heart attack, because their heart is pounding, the chest is tight, and what's happening to me. So this can then go on, they can go on to develop a panic disorder because they will have recurrent panic attacks and in between and be anticipating that they might have another one, which keeps their anxiety heightened. Oftentimes in the emergency department, emergency officers say, oh, we saw such and such a person, but he only had a panic attack. Well, only having a panic attack is a very serious issue. Sometimes we have panic attacks because we've got some medical problem. You might have a thyroid that's not a gland that's not functioning properly, and that could lead to a panic attack. In which case, if you treat the thyroid disorder, then chances are you're not going to have panic attacks, right? Or you may be on substances or illicit substances like cocaine or marijuana in some cases will cause tremendous panic attacks. You treat the underlying source and the panic attacks go away. But I'm talking about a panic disorder which is not related to that. These come on out of the blue and are very debilitating and interfere in your life. With respect to social anxiety disorder, that is more an anxiety that comes on, and this is really common. This comes on because people have tremendous anxiety. They're being watched. They're being scrutinized. Everybody is looking at them. And as a result, what often happens is then when they go into they can't go into Tim Hortons, they can't go into McDonald's, they can't go to movies, they can't get on the bus, they can't go to the movie theater or they can't be in crowded places. The mall is another one. They can't stand in line at a bank. Because what happens is they get all the physiological symptoms of anxiety that I've already described. And as a result, they've got to get out of there because they've got to get this settled. And lo and behold, what often happens, if it's happening, for example, in a mall, they go outside the mall, and all of a sudden, it all settles down and they feel better. But then what gradually happens next time, is they start anticipating, is this going to happen again? And then they start to avoid. Children, adolescents start to avoid going to school because it's happening. The same thing that happens when they have tried to go to McDonald's to order or go to a restaurant with their family, all of which they've now started to avoid. They can't get themselves from home to school, and if they get to school, they can't get into school, and consequently, the avoidant behavior begins. It's extremely common, and it is the most common presenting problem that we're seeing in the child and adolescent outpatient department. The other one, just very briefly, there is post-traumatic stress disorder. I'm not going to talk about that tonight, but let me just quickly tell you about obsessive-compulsive disorder. Now, we're all, to some degree, probably everybody sitting here, it has some obsessive-compulsive properties. You probably, or traits, you probably wouldn't be where you are today, either in school or work, if you weren't obsessive-compulsive to some degree, right? Because your boss probably isn't going to keep you. That's not what we're referring to when we talk about an obsessive-compulsive disorder. An obsessive-compulsive disorder consists of having obsessions and having compulsions. And this is where the pathology lies. Obsessions are intrusive kinds of thoughts that come into your mind, into consciousness, and you can't stop it. They are involuntary. And you know they don't make any sense, but you cannot stop it from coming. And it comes over and over and over again. And with it, it causes such distress, you have a great deal of anxiety, so therefore you're looking for a means by which you can decrease the anxiety. And what happens is you then develop compulsions. Now, compulsions are actions, and the usual type of compulsions are excessive hand washing, particularly if the thoughts are you've got germs on your hands, or if you touch something, you're going to get contaminated, or you're going to get ill, you're going to get sick. Or if I eat that piece of food that's touched another piece of food on the plate, that it is contaminated and there may be germs on it. Or like, are his mother and father or husband and wife sure that those dishes were really clean, the utensils were clean? And as a result of that, they have to wash and wash. In the beginning, it doesn't take so long and they can get stopped. But then it can go on for prolonged periods of time. to the point where they become incapacitated. And sometimes in a waiting room, when I see a new consult and, you know, the man, the woman, or the teenager or child is sitting in the waiting room, and I go out and I see their hands, and it looks like they've had gloves on because they're raw and red, and then it's white above. I know the history before I've even seen them, because they have engaged in such excessive washing, and they're now very, very incapacitated in their life. It's so time-consuming. So other compulsions are checking. People will check and check and check. And it becomes time-consuming because they have to keep checking and checking. It's like you're driving out of your driveway in the morning and the thought comes into your mind, did I turn the stove off? And you say to yourself, well, I know I turned the stove off, but the thought, the doubt is there. So what happens is you turn around, you go back, you go in, you check the stove, it's completely off. Phew. Now the anxiety is gone. You go back out in the car, and you go back out the driveway again to go to work, all of a sudden the doubt comes again. Are you absolutely certain that that stove was turned off? And no matter how you try to convince yourself, you can't, because the anxiety is there, the doubt is there.